I remember seeing a picture in 1993 of 4 sisters, and 3 of the sisters had developed early onset breast cancer. The 4th one was unaffected, but was about 35 years old. And I knew that at that point, had I seen that young sister, she would have probably had bilateral mastectomy recommended to prevent breast cancer. And that began my interest in and passion for genetics, because 1 year later, the BRCA1 gene was sequenced, and that changed everything.
It was a groundbreaking scientific discovery, but it wasn't going to make an impact unless we could get it into the clinic, where physicians and patients could use it for treatment planning.
What we do in the clinical setting is to identify the problems we need solved.
One of the main aha moments for us was that Dr. Stolier asked us a question one day, how about for women that are in their 20s or 30s with breast cancer, even though maybe they have no family history at all, that's such an unusual event. Do we think that maybe that might also be caused by a genetic mutation? And we looked at our data, and actually the risk was pretty high. Even if you had no family history at all, you probably should be offered genetic testing, and we found a lot of mutation carriers that way.
They have always been incredibly responsive.
Innovation is a constant partnership between the scientists that are in the laboratory discovering new things and the clinicians that are out in front of patients, talking to patients every single day.
The fact that they could do this test in less than 10 days was everything.
We can identify patients before they get cancer and change the trajectory of not having so many kids grow up without a parent, or not having family reunions be funerals.
And so it's really critical that clinicians in the community have access to genetic testing for their patients, because it allows them to manage them much better.
How do we take this amazing scientific discovery and make it easy and accessible for patients? There were several times where we really had to push on different stakeholders to say, why are we waiting for 6 people in a family to get cancer before we do something about this? We got to do better.
What impressed me about Myriad was that when they started doing genetic testing, they did not have to look at all the variants. They did not have to keep records of the patients that tested negative. They didn't have to do any of those things, but they did. They actually produced. And that was a real game changer for us.